We were talking a little bit about sustainability and how, once the CAPA project is finished, how can the good work be sustained going forward? And I guess that's the $6 million question, because it's really important that in the local partnership areas that we've been working in, that the staff have done fantastic work, have learned an awful lot, and it's really important that the partnership areas themselves take that forward. Care about physical activity and promoting movement is a huge fit with national policies and then local policies. And I guess the question to ask is, how can we build on this, and to make sure that how, as a partnership area, we're promoting movement and promoting independence continues to be discussed. And within organisations, say for example in a care at home service that we've been working with, they've had to look at their paperwork and thought, well, actually the good work we're doing isn't being reflected by the information that we have about the people that we support, about the people experiencing care. So they've changed their paperwork so that it's a lot more intentional from the start, that we're here about promoting independence, about enabling you to be as healthy and well as you can be, and what would you like us to do to help you. And other places have changed their job descriptions. It's a requirement as part of the job to promote movement and well-being and health and independence. Then if you're a manager within an organisation, how do you keep it alive? How do you keep it alive in one-to-one meetings with your staff, or in team meetings, or when you're out and about talking with people experiencing care, and really thinking about what are the questions that you can ask. For example, asking staff, what did you do today to help promote movement with somebody? Can you give me a story about something that you're trying that's working? And also things like interviews, job interviews. We know of a service who have started interviewing and being really explicit in interviewing, that in terms of promoting movement and so on, that this is really part and parcel of the job. And another area to look at is local connections. It's so important to realise that in Scotland we're so lucky, we've got so many really good local organisations who are ready to be invited in, to be able to invite people out. So for example, if you're a sheltered housing association, how do the people who live there know what's on their doorstep? How can they be invited to go and follow up on their interests in the locality? So what can you do about that? And of course, one big area that a lot of staff have learned about is improvement, and following the plan, do, study, act approach. So how, as organisations and partnerships and so on, can you use that knowledge and understanding to improve different areas within within your aims and local improvement plans and so on? Because you've got a wonderful resource here of people who are showing their ingenuity and their ideas and are used to working with the improvement approach, and why not use that for different areas as well. We're really lucky that we've got all of the care inspectorate, all of our colleagues, the care inspectors, who are visiting and working with managers right across the country, and they've done, as part of their professional development, they've been working on learning more about the importance of movement to people in care, and that's both older people and children, and they're able to bring that knowledge and some experience to bear when they're out inspecting, and when they're also working to help services improve in particular areas. So that's something else that will help with the sustainability of the project, because when the CAPA team are gone, the inspectors are still there to take the message forward, because it's so important in terms of making sure that we all have healthy and well lives, both now and in the future.